This video is about rehydrating a child who presents with gastroenteritis to your paediatric emergency department. And I'll caveat this video by saying we're talking about children in developed world situations who usually will present with only mild to moderate dehydration. And in those cases, oral and NG hydration is usually going to be enough. So in mild to moderate dehydration, we know that oral or NG hydration is at least as effective as IV hydration, and it's usually better tolerated by patients and their parents. And the typical rate you want to aim for the initial hydration over the first few hours will be about 10 mils per kilo per hour, say, for the first 4 hours of hydration. There are some protocols for rapid hydration using NG fluid. For example, the Royal Children's Hospital in Melbourne or Starship Hospital in New Zealand both have rapid rehydration programs where they say you can give 25 mils per kilo per hour for the first 4 hours if you want to kind of quickly rehydrate a child to get them home again. But just for the sake of simplicity, I'll say if you're assessing a child who's mildly dehydrated, it's a safe option is going to be choosing 10 mils per kilo per hour for the first 4 hours. Now, breastfed children can continue to be breastfed, and as soon as a child is hydrated, they can go back to having their normal milk. They don't need to have gradual milk reintroduction or, milk diluted down with water or anything like that. They can just go back to their normal feeds. And then the next thing I'll talk about is apple juice. So apple juice is actually a great hydration solution. You can mix it 1-to-1 with water, and that's been shown to be just as effective as the oral hydration solutions like Hydralyte. But with another caveat that this applies to children who have mild dehydration. So, oral hydration solutions are often designed for more severely dehydrated children. They're actually originally designed for use in the developing world. But, in somewhere like Australia, you can use apple juice 1-to-1 with water for most children that you see with mild to moderate dehydration, which will be most children with dehydration at all from gastroenteritis. And this is just better tolerated than the oral hydration solutions, which don't taste that nice. Next thing to say is you can use Ondansetron, the antiemetic, to reduce vomiting. This has been shown to improve the kind of success of oral hydration and improves the toleration of children for oral hydration, can reduce the need to intervene with a more invasive treatment like NG or IV placement. 96% is the number I want you to have in your head. So what does that refer to? That is the success rate of oral or NG hydration. So using the enteral route will be suitable in 96% of children you see with gastroenteritis, which is, that's a lot. That's, basically 24 out of 25 kids that you see are going to be fine without having to have an IV. So you really don't need to use IV access for most children. You just need to reserve it for that 4% where they're either severely dehydrated or the oral or NG hydration doesn't work. So IV hydration, as I just mentioned, is for severe dehydration. Remember to send bloods off if you're doing a cannula. I'm going to just say get advice about the rate. I think if you're more experienced, then you'll know how to kind of titrate the rate of fluids. That might be, for example, 2/3 of their maintenance requirements if they're able to eat and drink, or it might be up to 100% if they're not, if they're vomiting and they can't take any oral fluids, or if they're severely dehydrated and you need to replace, then it might be their maintenance plus 5% to rehydrate them over 24 hours. And there's a lot of ways of doing this, and I think the thing I would say is if you're junior and you're fairly new to giving IV fluids in children, just be cautious, ask for help, ask your paediatric or senior ED colleagues for advice on what rate and what fluids you should give, because you do need to be cautious. You can easily overdo it, giving IV fluids to children who don't have as developed renal function as the older people you might have treated before. So that's it for the topic of gastroenteritis. I'd really encourage you to read the Don't Forget the Bubbles article written by Angharad Wilson. It's a really detailed and excellent look at gastroenteritis from a kind of more paediatric perspective. But hopefully these videos have given you something to start with if you're in the paediatric emergency department and we're feeling a bit lost about seeing all the kids with gastro that come in.